Hey there, I'm Dr. Angie, and in this video, I'm going to be giving you information so you can decide if you want to vaccinate your dog for rabies. Now, I want to start by saying that rabies is its own class, and I feel like the rabies vaccine has a completely different conversation than other vaccines we use for dogs. And this is because rabies is uniformly fatal. I know there have been a couple people now, I think we have a handful that were able to survive rabies. They did have permanent brain damage, and I think we should just safely say that most dogs, like 100%, and 100% of people are gonna die from rabies. And there's no do-over. And so if we get this one wrong, there's nothing we can do. And so I wanna start by saying not to scare you, but because we just treat it differently. Now, I live in an area in Boulder, Colorado, where people are very active, and we're very much in contact with wildlife all the time. We do have rabies endemically here. We see it in bats, we see it in skunks. Every once in a while we'll see it in a coyote or a fox. We just had a case of a cat about an hour up the road. So it's here, and it's important that you know in your area how prevalent rabies is and what animals commonly carry rabies. Okay, so now we've had that discussion. It's fatal. We want to prevent it. Then the other side is we want to vaccinate only healthy animals. We want to take into account if your dog has had vaccine reactions. We want to make sure we're having a really balanced approach to vaccines for your pet. So usually what I recommend is I start the rabies vaccine at 6 months. Most veterinarians start it at 12 to 16 weeks. If I can, if your dog is not in a high risk situation, I like to wait till 6 months. I like their immune system to be a little bit more grown up. And then that first vaccine is licensed for 1 year. And then we do vaccines every 3 years after that. That's what Boulder County would like us to do. So the state of Colorado doesn't regulate vaccines. There's no law about rabies vaccine. That's just what my local jurisdiction, and that's what most guidelines recommend. Now, we know that rabies vaccines in many animals last longer than this, and the reason why we don't have this information is because the challenge studies to do this every time a vaccine is brought to the market, like a rabies vaccine, there has to be challenge studies to show that it works. And unfortunately, that means that dogs get infected with rabies. So they'll have a control group to make sure that all the dogs with rabies get rabies, and it's fatal. And then we have the group that have been vaccinated. And so we need a certain death rate in the group that didn't get vaccinated and a certain survival rate in the group that did get vaccinated. So we know that the rabies vaccine works. We have really good data to support that. But unfortunately, we don't have these studies to say, like, yeah, 7 years out, this vaccine protected most of the population, so we can do that. So it's not that pharmaceutical companies are trying to, do one over on us. It's just that to actually get those studies, it costs life to get. So right now, they're licensed for every 3 years, and that's just kind of the way it is now. In my practice, I do, for sick animals or animals that have had a vaccine reaction, we can do exemptions. We can test titers, basically where we take some blood and see if your dog has adequate immunity to the rabies virus. So there are certain things we can do, but if you're a person that would like to vaccinate minimally, I would say the rabies virus would be the one vaccine that I would do, and we can talk about the schedule that works best for your pet. Now, the worst case scenario, which I always like to run by people, not because I'm trying to scare anyone, but if your animal is out of date, and so like if they're overdue, let's say you gave them a vaccine 4 years ago and they've been overdue for a year, if your pet were to come in contact with rabid wildlife, so confirmed rabid wildlife, that's where probably the public health department would require your pet to be euthanized. So that's the worst case scenario. I think that's very unlikely, depending on your dog's lifestyle. one, to find, to interact with a rabid animal is quite unlikely, although it can happen. And then the fact that your dog would interact with them. But I always like to give people like the worst case scenario. Now, if your dog bites somebody and isn't up to date on rabies, they're not going to euthanize your dog. They're going to put your dog in quarantine depending on when the last rabies vaccine was. If your dog has had 2 rabies vaccines in their life, they look at that more favorably. So some of my clients, they do 2 and they never do it again, knowing that there is that risk if they came in contact with wildlife, that would be a rabid wildlife. Now, if they come in contact with wildlife that isn't known to be rabid, that's also a quarantine. It's a little bit longer. So if you have any questions, I know it's a lot of information. If you have questions, feel free to email me at Angie@BoulderHolisticVet.com, and I will talk to you soon.